Choosing the implant size is one of the hardest decisions you'll face leading up to your surgery. Patients and surgeons alike all have different expectations and desires. To accommodate this, Motiva offers a large variety of implant sizes and shapes, ensuring that there is something for everyone. There are a variety of factors to keep in mind when choosing the size of your implants, all of which you will discuss with your surgeon during your consultation. And together, you'll decide what's right for you. An important aspect that is often overlooked when choosing implants is the surface. Some clinical data suggests that the surface texture of a breast implant can affect the risk of breast enhancement complications. Implants with a rough texture may lead to complications due to tissue irritation and inflammation. Additionally, traditionally textured implants are often manufactured using substances such as salt and sugar, which are foreign to the body. The Motiva nanotexture surface is produced using a unique manufacturing method without added processing materials, with each contact point smaller than a single cell, mitigating the chance of complications due to tissue irritation. A common misconception among patients who are about to undergo breast surgery is that cohesiveness is the measure that determines the firmness of an implant. However, cohesivity and firmness are two different factors. As a demonstration, these three gels are equally cohesive, but they are not equally firm. Cohesiveness is the term for how well the gel of the implant holds together. It is viscosity that determines how firm the implant feels. Motiva's gels are highly cohesive, which means that they hold together well while being highly elastic. This holds true even for Motiva's unique Ultima gel, which is used in our softest implants. This offers greater assurance that in the unlikely event of an implant rupture, the gel migration is minimized, thus lowering the chance of further complications. Elasticity is the measure of how much something can be stretched and still come back to its original state. The ideal implant can be compressed and stretched without being damaged or rupturing. In Motiva implants, both the gel and the outer layer that houses the gel are extremely elastic and can stretch considerably without negative effects. In addition, elasticity determines the gel memory, allowing the implant to return to its original shape after movement. In general, the area most prone to damage on an implant is the seal on the back, since it's usually not as elastic as the rest of the shell. But Motiva True Monoblock features a unique technology that creates the same elasticity throughout the entire implant, including the seal. This allows the shell to act as a whole structure, making insertion easier and improving the implant's mechanical qualities under stress. To demonstrate, here's a comparison between a Motiva implant and an implant from another leading manufacturer. The high elasticity of the Motiva implant allows a surgeon to place the implant using a very small incision, resulting in a smaller scar. Finally, all Motiva implants are manufactured with Blue Seal technology. This unique process creates a visible barrier layer that makes it easy for the surgeon to verify that such an important feature is intact before surgery. Breast implants are usually divided into two categories, round and anatomical. But what exactly is the difference? Round implants provide a higher top and a more full-bodied appearance. They are the most common implants and are used in almost 80% of all breast augmentation surgeries. Anatomical implants are often called teardrop-shaped because they're designed to simulate the shape of a natural breast. While the result with an anatomical implant is natural-looking, the predefined shape means the implant lacks natural movement and doesn't shift with the body's movements. As an example, see how noticeable the lack of movement is when this patient goes from lying down to standing up. The implant retains the same shape whether the patient is prone or upright. Motiva's ergonomics implants avoids this drawback through the use of a unique gel which is very soft, allowing the implant to follow a woman's natural movement. Holding a round shape while lying down and assuming a teardrop shape when standing. This gives a very natural appearance, both in look and feel. Most patients have their breast implants for many years, with no complications that require them to access their implant information or guarantees, so it can be easy to misplace or otherwise lose track of that paperwork. To make it easy for patients and surgeons alike to access implant information, we created QID, a 12mm sized chip placed within the implant. Your surgeon can then use a special reader to read the chip and easily obtain detailed information on the implant and its guarantees. Motiva's general warranty covers implant rupture for the entire lifetime of the implant. It also covers a type of capsular contracture specified as Baker grade 3 and 4 for 10 years. Should any of these complications occur, the implant is replaced free of charge. Patients also have the option to choose an extended warranty that provides financial compensation for a possible revision surgery, if the implants are registered within 90 days of the initial surgery. You can learn more about our guarantees and how to register your implants at motivaimplants.com or by consulting your surgeon.